Hello, I want to welcome everybody today. We're going to be talking about a very particular topic, peripheral diabetic neuropathy, and we're going to go over some of the data and some information about new treatment options for peripheral neuropathy. So clearly this is a big issue in the population. We got 34 million people in this country who have diabetes. That's about 1 in 10, and unfortunately 1 in 5 don't even know that they have it unless their doctors, testing them and checking their hemoglobin A1Cs. So clearly this is, a very prevalent issue in the population. Now, of those with peripheral neuropathy, about 20% of them have peripheral diabetic neuropathy, and a great number of those, almost half, are refractory to medication management. So what we've typically done for patients over the years is to treat them with medication management, but we know from experience that a lot of times the medications don't give significant relief. For those who are not sure if they have diabetic neuropathy, a little bit of background here. So, symptoms, mainly numbness, loss of sensation, could start leading to pain. You may lose the ability to differentiate heat and cold. You may become unaware of cuts in the feet, which could lead to ulcers, which could lead to infections. A lot of times the pain is bad enough where people can't sleep at night. So this diagnosis definitely impacts people's functioning and their daily living. So, the current medications that are out there, just to sum it up, you've got Lyrica, you've got gabapentin, Cymbalta. Those are kind of like the three first line tricyclic antidepressants, but all these things have a tremendous amount of side effects, including sedation, including weight gain, including dizziness. So the medications definitely come with a price. So what is the effectiveness of conventional medication management? Well, essentially half the people you put on meds are not going to be helped. So that's pretty disappointing in terms of numbers, that your chance of getting better is like 50-50. And as we talked about, side effects, weight gain, sleepiness, dizziness, anxiety, all of those things that you can see with those medications. So let's talk a little bit about a new treatment option. This is HFX, and it is a peripherally implanted spinal cord stimulator that specifically treats diabetic neuropathy. Now, spinal cord stimulators have been around for decades. What's changed is the technology's gotten much, much better. So in the past, where the technology gave you kind of this pins and needly sort of feeling in the extremity, the new technology functions at such a high frequency, it's at 10,000 hertz. That means every second, this electrode in your back is generating 10,000 electrical impulses. What that means to you is you're not able to perceive that level of stimulation at that frequency. So bottom line is you don't feel anything and the pain gets better. It's a two-step process with the spinal cord stimulator. So it starts out with a trial, where you try it out and see if you like it. And then if you get at least 50% improvement from the trial, then you would move on to a permanent implant. This is one of the few systems approved. There's actually two that are approved. This is the one with the most robust data at this point. So they did a randomized controlled trial with these patients, diabetic neuropathy. 85% of patients who went through this got more than 50% relief. Compared to the medical management group, where only 5% of patients really did that much better with medication management. Now, I'm not saying patients don't get relief with medication, but I'm talking about like where you get profound relief, where you're at least 50% better. 70,000 patients have been treated with spinal cord stim, not all specifically for diabetic neuropathy, but This is a pretty, ubiquitous technology. We've been using it for decades for people with failed back surgery, for people with other neurological conditions. And this system allows you to test it out for a period of time. And then after you test it for, let's say, 5 or 6 days, then you can go on to get a permanent one if you like. I'm going to talk a little bit about some of the actual data here. So what this is they were looking at pain scores in the extremity, and what you have is average pain score of the CMM, which is medication management group, versus the spinal cord stim. And you could see for the medication management group, it barely moved the needle on their pain scores compared to the people getting the stimulators, where they went from a pain score of close to 8 all the way down to approximately 2. So pretty significant reductions, and this was sustained over many months. You will see it did take a month or two to kind of achieve baseline, so it does take a little bit of time. So here's the flow and the process. So if you've been diagnosed with diabetes, I'm assuming that they're monitoring your blood sugar and your hemoglobin A1C. In order to be a candidate, you need a hemoglobin A1C less than 10. That's not a very high bar. Even most poorly controlled diabetics are still under 8 usually, and if not, then their doctors are getting on them to do a better job. So if you have the diagnosis of diabetes and you're under hemoglobin A1C of 10, and you've been to a neurologist and they've checked for other causes, you don't have a history of chemotherapy or a history of a back issue, your blood flow is okay to the legs, you've tried a couple medications, now you're a candidate for the treatment. And I would say most of the people in my practice have achieved that level of jumping through hoops, as it were. So as long as you've done the workup to see that there isn't something else causing the pain, and you've gotten at least 2 medications that you've trialed, then you're a candidate for the stimulator. So basically, you come in, you have an assessment, we talk about the procedure. I explain the trial process. So the trial is a trip to the operating room, and under x-ray guidance through a needle, the stimulator wires are placed in the spine. They're placed a little higher than you think. Usually we put them in the mid-thoracic level, and that'll cover both legs very easily. A whole bunch of patient testimonials out there. I've had great results with my patients. And again, with the trial, you're not married to the device. You're just seeing what it can do for you. But what this can do for you is let you be more active and be a little more confident that you'll be able to get around with less pain. There's a whole team of people that are working with you. So each patient through the company that makes the device, which is Nevro, they would, partner you up with someone to support you. You can speak to other patients if you wish who've had the technology. But this is pretty new. Indications came out last year. But what's nice about this is it's quite robust data. The data is excellent. And this isn't a new technology that didn't exist before. This is a technology that we've been implanting for 20 years with a new indication. Now, they did change, the electronics in terms of the stimulation specifically for covering neuropathy, but this is not something that's untested and hasn't been used. So nice option for patients. I appreciate you taking the time to listen. If you have any questions or comments, please let us know. And please like and subscribe if you want to hear more videos. Thank you.